Mrs. Carver is a 70-year-old female with a history of diabetes who presents today with a persistent dehydration and nausea related to vestibular neuritis, with which she was diagnosed about 1 week ago. I saw her a week ago and we did a workup. She had dizziness on her initial presentation. We did a workup for distinguishing syncope versus vertigo, and then we did a workup to distinguish central versus peripheral vertigo. And with all of that workup, we decided that she had vestibular neuritis based on a history of cold-like symptoms, followed by some dizziness that she first experienced at a wedding that she attended. This wedding was a week prior to her first visit, so 2 weeks prior to her presentation now. After this diagnosis, we went ahead and just told her to take some rest time, that this would heal with rest. We did talk about steroids and antivirals, but we discussed that those have not been shown to improve the outcome in vestibular neuritis, and that she would be best to just rest. But we also gave her some ondansetron for nausea. The ondansetron has not helped. She's still nauseated, and she has actually vomited some now, and she's had decreased urine output. And so she's worried about that, and she also has high blood sugar at 292 right now. So we also last time discussed she was having some sleep trouble since her husband died about a year ago. And she had been drinking a lot prior to sleep every night to try and get some sleep. And so we discussed stopping drinking in the meantime and maybe going over some other way to get better sleep. So now on her presentation, it's the persistent dehydration, vomiting, persistent nausea, and the vestibular therapy is also not helping.